Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, November 10th, 2020. So it's been kind of a week in terms of the pandemic. A lot of milestones were passed just over the weekend, with the world passing 50 million cases and the United States passing 10 million. So that was an increase of 3.8 million new cases in the last week worldwide, which was about 300,000 more than the week before, which was itself 300,000 more than the week before. Here in the United States, we saw a record increase of 800,000 new cases in the last week, about 200,000 more than we saw the week before that. And here in Massachusetts, we saw about 12,000 new cases. In terms of deaths, those are also increasing in most places, with the world seeing 53,000 deaths from COVID-19 in the last week, which is about 6,000 more than the week before. And here in the US, we saw about 7,000 deaths, about 1,000 more than we'd seen the previous week. So breaking these down a little bit around the country, testing continues to go up on average, but cases are still skyrocketing, and hospitalizations are getting very high as well. Deaths are starting to arc back up following that hospitalization curve, which we'll look at a bit more here. So as you can see, we are getting very close to our highest number of people currently hospitalized in the country. The previous two surges topped out just below 60,000 hospitalizations, and we're likely to pass that possibly by the end of the week. So we are going to see some really overtaxed hospital systems around the country, and that may lead to sudden spikes in deaths as the hospital system just can't keep up with the number of cases, and we just run out of equipment to treat all the people we need to treat. So looking at where this is happening, looking around the country, the Midwest still continues to be the hardest hit, though everywhere is trending upwards. And now this is not a graph by population. This is just in terms of raw cases. That's how high the Midwest is right now. And the West has passed its previous high point of the midsummer spike, but the South and even the Northeast are actually getting pretty close to passing their original highest points, possibly in the next couple of weeks, if things don't turn around. And as I said, this is only a graph of raw numbers. This is not adjusted for population. If we look at it that way, it gets even more so for the Midwest. We can see perhaps a little more clearly how things are trending in these various areas and how they compare to one another. But you can see that while things are doing the worst in the Midwest, here in the Northeast, we had a pretty sharp increase over the fall that is perhaps sharper than the ones seen in the South or the Midwest. That's something we're going to have to be careful about. And just looking across the country here, this is where new cases were looking yesterday. As you can see, there's not really a lot of places left that are seeing fewer than 1,000 cases a day. And some places, Illinois there, saw 10,000 cases for 4 days in a row. So it's just, there is really no area that the virus is spiking now, like in the previous two surges. It's just everywhere, except arguably Vermont. So one other way to see how this is going and how we in Massachusetts are doing, this graph shows how different states have done in terms of cases by 1 million people over the course of the pandemic. So what I have selected here, and if you want to go to the COVID tracking project and play around with this, they've got a number of tools like this. We have the arc that is Massachusetts, which goes spikes up in the beginning and then comes down. This boxy shaped spike is where we released a number of backlogged cases that threw off our numbers for a little while. You can see Vermont, which has a subtle spike here and then stays low for the rest of the course and is currently the state with the fewest cases per million people. And then you've got North Dakota, which is low and then gets higher and keeps going and is the state with the most cases. So you can see there, Massachusetts is, towards the lower end of the pack. I've got this line here showing where our highest peak was early in the pandemic, back in April. But we are trending upwards. We're getting pretty close to where we were. Now, comparing things to the spring surges is a little, isn't really indicative when we talk about case numbers, because back in those days, we didn't have the testing infrastructure we do now. So generally speaking, people were only getting tested when they were serious cases. So it's likely that the number of cases was many times more than we were actually aware of at that point. So getting up to just those case numbers doesn't necessarily mean things will be as bad as they were then. That said, it's still not a good place to be, because one thing that doesn't change from that is hospitalizations, which we have a much clearer idea of. So here again, we have Vermont as the state with the least hospitalizations. At this time, South Dakota is the most. These are per million people. And then there's us in the middle there. So we had our big spike at the beginning, one of the states with the most after New York and New Jersey. And then we've come down, and while our cases are increasing, our hospitalizations are increasing, we are still pretty far down there in terms of states groupings, much further down than we were on cases, in fact, it would seem. So that's something to be aware of there. And then this is a slide from last week, but I wanted to put it up again here. This shows how cases are reported by day of the week, which I think is important because it kind of lets you look at the cases reported on any given day and realize where things stand. We've had some of our highest case counts ever over the last couple of days. And yesterday was, a top 5 day for a Monday. And so we should expect to see record numbers again this Friday. So speaking of that, let's move on to developments, because of course, the first development is the records that continue to break. That is a bullet point that I have not taken out of this slide for several weeks, but it keeps happening. So when I was putting this together yesterday morning, the 5 days with the highest US case counts were November 7th, 6th, 5th, 4th, and 8th in that order. Now, yesterday came through, and I believe that's going to slot in around the 3rd spot there. But again, seriously, the last week has been the highest case counts. We broke records 4 days in a row last week, and we're lined up to do that again this week. In other news, well, the election has finally come to a conclusion, more or less. So that is going to lead to some changes down the road. The president-elect has laid out a lot of his plan for the pandemic, and it's very different than the current administration's plan. So we will be seeing a lot of changes in the near future, and that is something to be aware of. And speaking of the White House is experiencing its 3rd COVID cluster. The first one, of course, being when the president tested positive. The second, when there was a staffing cluster of COVID cases within assistance to the vice president. And this one, notables who've tested positive include Chief of Staff Mark Meadows and Head Secretary Ben Carson. This outbreak was linked to an election night party, and we'll see how much further it spreads from there. In better government news, the FDA has granted emergency use authorization to an antibody treatment from Eli Lilly, the drug bamlanivimab. This is one that Governor Chris Christie received, not the one that the president received. This treatment, however, is only for new infections, for people who are at risk of having severe ones. It has not shown to be effective for severe cases. Eli Lilly expects to have around 1 million doses by the end of the year. Of course, when we know that we are seeing over 100,000 cases per day, and there's over 45 days left in the year, you can kind of do the math on how much that's going to be for everyone there. Another even very exciting news is that Pfizer has released some early vaccine data, which is very positive. It has been found to be 90% effective, which is pretty impressive. For comparison, a measles vaccine is 97% effective, smallpox 95%, chickenpox vaccine is 92% effective, and your typical seasonal flu vaccine is anywhere from 40 to 60%. So this is very promising. Of course, this is still very early results. We will get full results later in the year. And it's also worth knowing if the vaccine actually prevents infection like a measles or smallpox vaccine would, or if it just reduces the disease severity, which would not prevent spread, but would still be important in preventing death. So even if it just does that, that's still good. This is also very promising because the Moderna vaccine uses a very similar mechanism. So if this one works this well, that one's likely to as well. And so we're like to have 2 vaccine candidates coming out next year that are going to be very effective. So now, of course, these also do have some logistical hurdles with them. The Pfizer vaccine has to be stored at around -70 degrees. So there's going to be some difficulty in getting that to certain areas. But again, we'll have several other vaccine candidates that are a little bit more shelf stable coming out following them. Overall, there has not been a lot of other changes in the vaccine progress here. 2 new projects joined phase 1 in the last week, which just shows you how many, there's some point we're going to have a embarrassment of riches in terms of vaccines if most of these turn out to be effective. But of the ones in the phase 3 trial, we should start seeing results fairly soon, which is exciting. For all the stats and trends data, we've always got the usual sources, COVID tracking, New York Times, and of course mass.gov for all of the local numbers. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.